This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Monday, May 11th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. The White House is pushing ahead with its focus on states easing coronavirus lockdown restrictions and reopening parts of the U.S. economy, despite dealing with infections among its staff. At least 2 White House aides have tested positive for COVID-19, a valet for President Donald Trump and the press secretary for Vice President Mike Pence. Dr. Anthony Fauci, a White House chief expert in the fight against the coronavirus, is self-isolating, although he has tested negative. Now to Africa, where Ghanaian President Nana Akufo-Addo has announced that one worker at a fish processing factory in the coastal city of Tema has infected a whopping 533 other workers at the facility with the coronavirus, according to Reuters. Ghanaian health officials reported the outbreak at the industrial facility late on Friday. Reuters says the new cases have pushed Ghana's total since the pandemic was first reported in mid-March to 4,700, the highest number of infections in West Africa. President Akufo-Addo says 22 people have died of coronavirus-related causes, but nearly 500 have recovered. Egypt reported almost 500 new cases of coronavirus Friday, its highest daily increase to date. Egypt's health ministry says its death toll from COVID-19 is now above 500. Zambia's finance ministry says it has applied to the International Monetary Fund for a COVID-19 related rapid credit facility as it starts the process of shortlisting financial advisors to help reduce its debt load. Worldwide, the number of confirmed coronavirus cases has surpassed 4.1 million. The global death tally is more than 282,000, according to Johns Hopkins University. More than 1.3 million people in the U.S. have been infected, and more than 80,000 have died. In Senegal, during the Muslim holy month of Ramadan, the majority Muslim population normally rushes to bakeries to buy bread for breaking the daily fast. The coronavirus raised the risk of crowds at bakeries spreading the virus, which has nearly 1,300 infections and at least 13 deaths in the West African nation. To halt the pandemic, the government banned selling bread at shops and launched a delivery assistance program called Sell Me Your Bread. Esther Janjo reports from Dakar.
The coronavirus lockdown has hurt many businesses in Senegal, but bakeries are booming as the Muslim-majority nation breaks the daily fast for the holy months of Ramadan. Authorities closed most bakeries to walking traffic to prevent crowds rushing to buy bread before sundown and further spreading the virus. To ensure Senegalese get their daily bread, the government launched a delivery assistance program in the capital called Sell Me Your Bread.
You have a platform where people go online, book the bread, or phone numbers where they call to order the bread 2, 3, 4 hours prior to the time for breaking the fast. And the young entrepreneurs that do the last mile delivery go pick up the bread and deliver it to the families and households everywhere in Dakar.
The program also gives loans to support delivery companies like Ubuntu Express, which hired 10 more people to meet the demand.
We are receiving a very large flow of calls for this project, and so we have gained competence on one side. We are constantly thinking of suitable equipment to be able to meet the demand of the Senegalese, because I point out the issue of bread is very sensitive in Senegal, because the Senegalese are very good consumers of bread, especially during Ramadan.
Bakery customers have welcomed the bread booking and delivery service.
With the coronavirus now, we're all confined, and it's better to stay at home. So, this is an initiative that is really welcomed.
Dakar's Sell Me Your Bread program is being tested throughout the months of Ramadan. If successful, authorities plan to extend the service across Senegal for as long as the coronavirus remains a threat. Esther Githui-Ewart for VOA News, Dakar.
Since the outbreak of the coronavirus, countries worldwide are struggling to contain the virus. It's even more problematic in Zimbabwe, where the nation is battling hyperinflation, the COVID-19 lockdown, food shortages, and high unemployment. Restrictions on movement and business during the pandemic is hitting ordinary citizens very hard. To gain perspective of what is exactly happening, Africa 54's Paul Ndiho spoke to Ivy Chimbwanda, a Harare-based entrepreneur who says life is too hard.
Ivy Chimbwanda, welcome to Africa 54. How are you?
I'm fine, thank you. Thank you for having me, Paul.
How are things in Zimbabwe?
Things in Zimbabwe are pretty okay. We're just a bit scared, uncertain of what's going on, and just anxious, really, just not so certain of what direction to take with life right now.
How is the lockdown affecting people in the business, especially you as a businesswoman? How has this impacted the business that you do?
Business has been very difficult, considering a lot of people, we are buying stuff from abroad or within the region and bringing stuff in to sell. So trade has really gone down, stocks are running out. We're not so certain when next borders will open up, so when we'll be able to just purchase our wares and proceed with business as normal. Business for maybe retail has been booming. Well, not exactly booming, but they've been doing pretty okay considering they've been open from 9 a.m. until 3 p.m. in the afternoon, people queuing just to buy basic necessities to get them by.
How much of an impact has COVID-19 had on the general population?
Children have stopped going to school. Already we were struggling with just day-to-day business activities, generating enough money to sustain you through the month, suffering hyperinflation. It's just been a really, really torrid time for us here in Zimbabwe.
What are you doing to overcome some of those challenges as people in the business community? What new ways have you come up with, at least to stay alive, to stay in business?
We've all turned to online selling. We just sell on all networks, whatever you have, whatever you're selling, push it through your WhatsApp, your Facebook. We've turned to a lot of social media to push our products. And then also we've started to do deliveries, like door-to-door deliveries. So within your area, you know, because we've got roadblocks where you can't cross over into the next neighborhood or try and get into a main area. Say, for example, if you live within town, like the flats in town, you're just going to sell to the people that you can easily access without having to encounter the police and the soldiers.
So you mean movement is restricted across the country?
Yes, movement is very restricted. You need to have a pass or a letter that will allow you to move from area to area. You also have to have a very valid reason of where you're going. They are implementing the mask system where you have to have a mask on your face whenever you're outdoors. The only time you cannot have a mask is when you're in your house.
The last time I was there, people were having hard times just trying to get cash to buy basic stuff. I wonder, how is it like now? Is it still the same thing, or things have improved a little bit?
In terms of cash circulation, things have not improved. Our banks are closed. They only open for remittances. That is on between Tuesdays and Thursdays, you can get international remittance. And then for general banking, everybody has to do somewhat of online or electronic banking. As for cash circulation, I honestly wouldn't know when the last time I actually held physical cash was, but not everybody has physical cash. We all have to use the mobile money transfers, and it's a bit difficult considering you can't trade, you can't do any form of business. How are you generating revenue to then be able to just buy what you need?
If you're saying that people have resorted to using maybe social media to transact business, how easy is it for ordinary people to access the internet?
Yes, ordinary people have been left out of this because amount of money we need for data has just skyrocketed. We've just had increases on data. So you find that a lot of people, yes, we all have devices, we can do online payments, and we have this mobile money transfer, which seems to be working more than actually going online and doing payments. And it's not so easy for the layman to just go into your banking system and use your internet banking.
Thank you so much, Ivy.
All right, thank you.
That was Africa 54's Paul Ndiho speaking to Ivy Chimbwada, a Harare-based entrepreneur. This is a story about books in an unlikely place and their struggle to get into the hands of people during a national lockdown. South Africa's East lockdown means books are finally available for sale again, but in the nation's biggest city, with its reputation for speed and hustle, do people care? VOA's Anita Powell takes us on a literary journey through the unlikeliest of literary towns, Johannesburg.
Once upon a time, journalist and writer Griffin Shea embarked on his dream of opening a bookstore in downtown Johannesburg. Then came the plot twist. A deadly virus became a global pandemic. Millions fell ill across the world. Hundreds of thousands died. South Africa announced a total 35-day lockdown to try to stop the spread. All non-essential businesses had to close, Shea's included. Johannesburg, the mining town founded because of its massive underground gold seam, likes to tell a story about itself. This, we say, is a town of people on the move, with no time to stop and take in something as indulgent as a book. That story, Shea says, is just not true.
We have 12 booksellers within one block of the store. So when people came to me like, oh, why are you open a bookstore in the CBD? Like, no one reads down there. And it's like, well, the real challenge is how am I going to compete with all these other booksellers? Like, how are we going to differentiate ourselves?
International studies confirm that Johannesburg is a book town.
There's this World Cities Cultural Report. Basically, it's looking at like, how many cinemas do you have? How many movie theaters? How many libraries? How many bookstores? And the last time Joburg participated, we actually had more bookstores than almost any other city surveyed.
Now, as South Africa begins to slowly ease the lockdown, the government says books of educational value are allowed for sale. Most booksellers, Shea included, are taking a very liberal view of that, arguing all books have educational value. Writer and activist Eleanor Sisulu agrees and says there's a wealth of original, valuable literature here.
Emotionally, books are important, psychologically, educationally, culturally as well. You know, for the community, African language speaking community, there's been a big move, especially by younger people, to read in their own languages.
Shea says he's had no problems from the police since he relaunched internet sales this week. Actually, he says a few officers have stopped by, checked on his hygiene precautions, and then bought books. South Africa's publishing industry is the most developed on the continent. But even so, many of its releases don't leave African shores. Shea says that's a shame.
On a bright August
So we asked him to get in on the pandemic trend of reading aloud. This is a selection from his new children's book, The First Story Ever Told. Enjoy.
So when the world was new, in the first village there ever was, lived a mother, a father, and 10 children. Mother worked during the day, and father carved animals for the children to play with. They were very happy.
We'll leave you there, safe in the magical world of books, wherever you may actually be. Anita Powell, VOA News, Johannesburg.
European markets are beginning the week on a high note, with all three major indexes making gains in early trading Monday. The FTSE in London and the DAX in Frankfurt are both 0.4% higher, while the CAC 40 in Paris is down slightly at 0.2%. The trading day began with significant gains in Asia, led by Hong Kong, which gained 1.5% by its closing day. Japan's and Taiwan's indexes gained just over 1%, while Australia's S&P finished 1.3% higher. The indexes in Seoul and Shanghai sustained slight losses. Investors appear to be showing more confidence in the global economy's outlook as nations around the world gradually ease restrictions imposed at the start of the coronavirus pandemic that ground nearly all economic activity to a halt. All three major U.S. indexes remain in positive territory in futures trading. We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address, is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, millions in Spain resume sports activities after weeks of one Europe's strictest lockdowns. We'll be right back after this break. Welcome back to Africa 54. Researchers worldwide are searching for remedies to treat COVID-19, the disease caused by the coronavirus. There are some drugs that show promise. However, fears among the public can lead to searches for unproven therapies.
Before meeting with patients, Dr. Katrina Kadir sanitizes and suits up in personal protective equipment, or PPE, to avoid catching coronavirus.
So every patient that comes through the doors is considered as positive. So until proof otherwise, so we need to make sure that we are fully prepared and protected when treating the patients.
The plastic face shield she's wearing is not from a factory. It was made in this home about 10 kilometers away. It's where William Elvis has turned his dining room into a production hub, with 8 3D printers making face shields. Elvis is part of a Facebook group with more than 500 volunteers producing PPE for frontliners across Malaysia. So far, his family has spent the equivalent of about $1,500 of their own money to make thousands of face shields for hospitals across the country.
No other people are more important than the frontliners. And if they need something, then I gotta produce it. That's my thinking.
Before this global health crisis started, Elvis already had one 3D printer. Friends recently pitched in to buy another 4 so he could produce more face shields. The other 3 printers belong to a community center Elvis co-founded but is currently closed. Elvis, a salesman at an e-learning company, has not worked much recently, so he spends his time producing PPE.
I got into this because I like to do a lot of tinkering and I love community.
Elvis got designs for the face shields from the Facebook group. The process starts with spooled plastic filament. It's fed into a 3D printer where it heats up, melts, and is layered onto a heated plate and then shaped. Each machine produces 2 frames at a time in about an hour. Elvis's wife Miranda adds a plastic sheet to the frames, which provides the actual protection.
My motivation is this. I got to protect the frontline at all costs, because if they go down, who's going to protect me? Who's going to protect us?
I would like to say a big thank you to all these volunteers who have come up with a lot of donations and efforts in making sure that the frontliners are always well protected.
So the appreciation flows both ways, as volunteers help protect frontliners, so the frontliners can protect the public. For VOA News, Dave Grunebaum, Kuala Lumpur.
After weeks and sometimes months, countries around the globe are starting the process of relaxing stay-at-home orders and trying to figure out the best way to restart their economies. The way they do so depends on how severe the COVID-19 pandemic is affecting their nation and how they responded. Kelly Magsamen is the Vice President of National Security and International Policy at the Center for American Progress, a non-partisan research and educational institute. She spoke to VOA International Edition Steve Miller about what the U.S. could learn from other nations moving forward.
Well, we took a look at about 9 countries across both Europe and Asia. As we were looking at a number of countries like New Zealand and Germany and South Korea that were just starting to reopen, we wanted to sort of assess whether or not there were some common factors that allowed them to be successful and put them in a place to reopen. I would say we learned a few things. First is that early action was really essential for many of these countries to put them in the position where they are now to be able to reopen. And so what I mean by early action is, very early lockdowns. In the case of New Zealand, for example, New Zealand issued lockdowns well before they even had any deaths. South Korea and Germany implemented very early testing sort of across the board. Germany actually was already doing about 350,000 tests per week by April. So really early national comprehensive effort was really required to put these countries in the place where they are now to be successful. Some of the other cases that were less successful had challenges in that regard, especially Italy, and of course, as you see, are seeing now the United States, which lost a considerable amount of time early on in terms of a national comprehensive strategy. So that was one of the real early lessons. The second thing that we're learning is that it's really hard to divorce both economic recovery from the public health strategy and response. It's very clear that those countries that are in a successful position to reopen really went early, went hard, testing, contact tracing.
That seems to be the mantra, testing. So the countries that were, in your words, successful, what is the goal for testing? Is there a number that can be extrapolated from your research as a percentage of the population or per capita that is a good target in terms of testing to see how pervasive the virus is?
Well, I do think it's important to note that every country is very different. Everyone's system is different. If you look at the case of Germany, for example, they've been very successful at nationwide testing, but they also have a federalized system similar to ours. And there are challenges in the cases of monitoring, contact tracing, doing sort of lockdown efforts across Germany because it's a federated system very similar to the United States. So what you're seeing now in the United States in terms of some states reopening, others not, is something that other countries with federated systems are seeing as well. I don't know that there's a perfect number, but certainly the U.S. is nowhere near its peers in terms of testing rates. In fact, we're far below most countries in Europe. We're below Canada. We're even actually below Italy of all countries. In terms of per capita testing. So I don't know that there's a perfect number, but certainly the rate of testing that we're seeing now is totally inefficient.
You also brought up the topic of contact tracing. Now, South Korea implemented mobile phone applications that its citizens, people entering the country, had to download they were required to check in, and then if they were to found out to be testing positive for COVID-19, blasts would be sent out to those who have the app to let them know that where these individuals were, and so they could be tested or see if they are exhibiting symptoms. The privacy concerns of such applications is a whole nother topic to discuss. But in terms of contact tracing, what have you seen in your research that is sufficient to help governments curb the spread of COVID-19 to allow them to reopen?
Well, definitely technology. Certainly some of these applications being used in South Korea, for example, and other parts of Europe have been pretty effective. And actually, we're finding that a lot of people find enough trust actually to actually participate in those contact tracing applications. That's a good thing. There are privacy concerns. I think those can be mitigated. CAP has done some research around how best to mitigate those privacy concerns in terms of anonymizing data and having things be erased after use. But certainly some sort of dimension of technology applications and definitely local government locality response, the ability to have people to actually do the tracing. You're going to need still a number of workers to actually to man the tracing. So it's not just a technology piece, it's going to be a human capital dimension as well.
So moving forward, what kind of recommendations can be made in terms of governments who are looking to reopen, and what should they be on the lookout for? Should there be a resurgence of COVID-19 cases? I
think we should, and what our research has shown is that we should expect sort of second waves, third waves. If you look at the case of Singapore, for example, it looked very successful early on in tackling the virus spread. And of course, it's had a resurgence among its migrant communities who are very vulnerable and who live in very close quarters. So it's been difficult to control the spread of the virus. So I think countries local governments, states all need to be prepared for second waves, and what they need to have put in place some criteria and thresholds for what they would do to potentially reinvest in a lockdown or reconsider additional measures to take. But I do think at the core of this is it's a testing challenge. We're not going to be able to do much of this unless we're able to test in a widespread manner.
In our sports news, Spain, among the coronavirus pandemic's worst-hit nations, is gradually relaxing what was some of Europe's strictest isolation measures that forced millions to stay indoors. In this report, narrated by Jonathan Spear, Alfonso Bito in Barcelona tells us millions are now heading outdoors to enjoy the sunshine and resume their sports activities for which they have long been deprived.
João Soares is a manager at an international company, has lived in Barcelona for 8 years. Like so many others, the lockdown has forced him to stay home and telework and give up the things he loves, especially sports. But with his bike roller bought before the shutdown, Soares has covered 1,000 kilometres, all inside his home. Relief came in the last few days when the government relaxed the COVID restrictions, permitting Soares and others to enjoy their sports outdoors.
This is the first day, so everyone is very excited to come outside, and the day is beautiful, so it's a perfect combination.
Soares is among millions of outdoor sports lovers in Spain, enjoying the freedom of being outdoors again. Some of Spain's beaches have reopened, but not in Barcelona, where runners and cyclists crowded the seafront.
So after 46 days lockdown, this is amazing, seeing so many people outdoors and being able to practice sports again.
Many people are not wearing masks, and not everyone has been following the rules on social distancing. It will be only a matter of time before people return to their normal habits, say experts.
At first, right after the coronavirus, there will be a clear impact. People will be affected for what happened. But after a while, people come back to their daily normal life. Everything will be the same.
Meanwhile, though, to prevent crowds, restrictions remain in place on who can go out and when.
From 6 to 10, we are allowed to do sports. From 10 to 12, elderly people. From 12 to 7, kids. And then from 8 to 11, we are allowed to do sports again.
In Spain, like in other countries, the process of reducing restrictions has started with allowing small shops to reopen, along with hairdressers, by appointment. Restaurants and bars are allowed to do takeout, and masks are mandatory on public transportation. For residents of a country whose economy and nerves have been battered by the lockdown, every bit of freedom recovered is something to be savoured. For Alfonso Beato in Barcelona, John Spear, VOA News.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.